Hey there, YouTube family. My name is James, and I wanted to welcome you to the Everything Healthcare channel. If you landed on this video, then you're probably interested in learning more about how health insurance works in the US. There are so many terms and rules that it's honestly kind of a hot mess. That's why I've done my best to explain it as streamlined as possible, but if you have to take notes, I don't blame you. Before we move forward, I wanted to quickly tell you two definitions that might be useful for understanding what I'm talking about today. An insurance premium is the amount you pay for your health insurance every month. You can imagine that your premium is kind of like paying rent. Out-of-pocket cost is more self-explanatory. It just means paying for something from your personal money, usually on top of what is covered by insurance in this case. Without wasting any more time, let's get straight into it. First up, we have HMOs, or Health Maintenance Organization plans. These plans typically have a network of providers that you must use for all your medical needs. If you see a provider outside of the network, you'll likely have to pay more out of pocket. HMOs often have low out-of-pocket costs, but they also tend to have a little more limited network of providers. PPOs, or Preferred Provider Organization plans, also have a network of providers, but you have more flexibility in choosing providers outside of the network. You'll typically pay more out of pocket for seeing a provider outside of the network, but you will still have some coverage. PPOs tend to have higher out-of-pocket costs than HMOs, but they also tend to have a larger network of providers. POS, or Point of Service plans, are like a combination of HMO and PPO plans. They have a network of providers, but you have more flexibility in choosing providers outside of the network. You will typically pay more out of pocket for seeing a provider outside of the network unless the primary care provider has made a referral to the out-of-network provider. EPOs, or Exclusive Provider Organization plans, are similar to HMOs in that they have a network of providers, but you will typically pay more out of pocket if you see a provider outside of the network. EPOs tend to have lower out-of-pocket costs than PPOs or POS plans, but they also tend to have a more limited network of providers. HDHP, or high-deductible health insurance plans, have a high annual deductible, which means that you will have to pay a significant amount of money out of pocket before the insurance plan begins to pay for your medical expenses. HDHPs tend to have lower monthly premiums, but they also tend to have higher out-of-pocket costs. Catastrophic plans are designed for people under 30 who have a hardship or affordability exemption. They have low monthly premiums, high deductibles, and limited benefits. They may not cover certain services or treatments until the deductible is met. Short-term plans are designed to provide temporary coverage for individuals who are between jobs or are waiting for other coverage to begin. They tend to be less expensive than traditional health insurance plans, but they also tend to have more limited coverage. Indemnity plans allow you to see any provider you want, but you will typically pay more out of pocket if you see a provider outside of the network. Indemnity plans tend to have higher out-of-pocket costs than HMOs, PPOs, or POS plans, but they also tend to have a larger network of providers. When choosing a health insurance plan, it is important to consider your own personal needs and budget. You should also consider the network of providers, the out-of-pocket costs, and the types of services and treatments that are covered by the plan. It's also important to consider if any of your preferred doctors or hospitals are in the network. Now that we know the different types of insurance plans, we should talk about looking for a provider. In-network providers and out-of-network providers refer to the healthcare providers that are part of a specific health insurance plan's network. In-network providers are healthcare providers who have contracted with the insurance company to provide services at a discounted rate. When you see an in-network provider, you will typically have lower out-of-pocket costs, and the insurance company will pay a larger portion of the bill. Out-of-network providers, on the other hand, are healthcare providers who do not have a contract with the insurance company. When you see an out-of-network provider, you will typically have a higher out-of-pocket cost, and the insurance company will pay a smaller portion of the bill. In some cases, out-of-network providers may not be covered by the insurance plan at all. The difference between in-network and out-of-network is important to understand when choosing a health insurance plan, because many insurance plans have a network of providers that you must use for all of your medical needs. And if you see a provider outside of that network, you'll likely have to pay more out of pocket. It's important to check with the insurance company or visit their website to see which providers are in network, and also to check with the doctor or hospital you're thinking of using to ensure that they are in network before receiving any treatment. Now, switching gears here, we need to talk about a commonly misunderstood term. An insurance deductible is the amount of money that a person must pay out of pocket before their insurance coverage begins. In other words, it's the amount that the insured person has to pay before the insurance company starts covering the costs. So for example, if a person has a $1,000 deductible, they will have to pay the first $1,000 of their medical expenses before their insurance coverage kicks in. After the deductible is met, the insurance company will begin to cover a portion of the remaining medical expenses, often with co-payments or co-insurance. Deductibles vary depending on the type of insurance plan, and some plans have very low or no deductibles while others have high deductibles. It's important to understand that the higher the deductible, the lower the premium will be, but the insured person will be responsible for a larger amount of money before the insurance coverage starts. Okay, so at this point you might be wondering, how can I go about obtaining health insurance? It turns out that there are several ways to get health insurance here in the US. The first is through employer-sponsored insurance. Many employers offer health insurance as a benefit to their employees. This is the most common way that people get it. Then we have individual plans. If you are self-employed or you don't have access to employer-sponsored insurance, you can purchase an individual health insurance plan through the government-run health insurance marketplace or directly from insurance companies themselves. Medicaid is a joint federal and state program that provides health insurance to low-income individuals and families. Eligibility and coverage vary by state, and also Medicare is a federal health insurance program for individuals who are 65 or older, people with certain disabilities, and people with end-stage renal disease. Children's Health Insurance Program, also known as CHIP, is a joint federal and state program that provides health insurance to children in low-income families who do not qualify for Medicaid. COBRA, the Consolidated Omnibus Budget Reconciliation Act, allows certain individuals to temporarily continue their employer-sponsored health insurance after leaving their job. Another important way to receive health insurance is through the Department of Veterans Affairs, also known as the VA. They provide healthcare coverage to eligible veterans. This coverage is separate from private health insurance plans and is available to veterans who meet certain eligibility requirements. VA healthcare coverage includes a wide range of services, including preventative care, primary care, specialty care, mental health services, and prescription drug coverage. The VA also offers a variety of healthcare plans, including VA priority groups, where veterans are assigned to one of 8 priority groups based on their service-connected disabilities, income, and other factors. Priority Group 1 veterans have the highest level of need and receive the most comprehensive healthcare coverage, while Priority Group 8 veterans have the lowest level of need and may have to pay for copays or certain services. There are many more programs that the VA offers, so I would definitely contact them if you're a veteran to see how they can help you. Okay, so now that you have health insurance, what's next? Well, you want to make sure that you're paying your premiums if your plan has one. Try to make sure your current and future providers are in network with your plan. And lastly, live your life at ease, knowing that there's an added layer of financial safety to back you up. The main takeaways here, in my opinion, would be learning as much as you can from this crazy system and making it work for your situation. Things like the Affordable Care Act have definitely made getting health insurance much easier, so don't forget to take advantage of programs like that. Thanks for sticking around to this point in the video. I hope you are now armed with the information you were seeking, because it could make a big difference in your life. It would mean the world to me if you could hit that subscribe button, as I am trying to reach my goal of 100 subscribers by March. Also, smash the like button if you enjoyed the content. I have something new for you every week, so stay tuned and see you next time.